All right, let's talk about the very important differences between a deductible and an out-of-pocket maximum. In several of our videos, specifically those that cover the cost comparisons between different plans, how Advantage plans work, and how Part D coverage works, there have been a lot of comments where people are confusing a deductible with an out-of-pocket maximum, and these two terms are very different. Let's start with a deductible. The official definition of an insurance deductible is a specified amount of money that the insured, that is you, must pay before an insurance company will pay a claim. Once you meet your deductible, your insurance company will then begin helping pay for your claims, and you will then only have things like smaller co-pays, smaller co-insurance amounts, or with some plans that make things confusing for all of us, which I'll talk about later in this video, the deductible is the same as the out-of-pocket maximum. Now, the definition of an out-of-pocket maximum is this. It is a cap or limit on the amount of money that you have to pay for covered healthcare services in the plan year. If you hit that limit, your health plan will pay 100% of all covered healthcare costs for the rest of the plan year, not the same as a deductible. Let's pull out the trusty whiteboard to go through some examples that will relate to your life before Medicare and your life on Medicare. If you are not on Medicare yet, you are likely experiencing a high deductible health plan through work. Federal and state employees, as well as some other employers, may have a more traditional health plan that works a bit differently than a high deductible health plan, but the use of a deductible is the same regardless. So with this pretend example plan, let's say that it has a $3,000 individual deductible, and after I meet my deductible, my insurance will cover 80% and I have a 20% coinsurance. Finally, my plan has a $6,000 out-of-pocket maximum. This means that with the exception of some preventive services, any care that I get will require that I pay the first $3,000 of billed charges out of my own pocket. Insurance isn't paying for anything until that point. So let's pretend that I'm having some knee pain and I want to go get it checked out. I'll visit a specialist maybe twice, which will have a charge. I'll get an MRI, which will have a charge. And since I played a lot of basketball and tennis, I now need to have a surgery on a torn meniscus, which will have a charge. The total bill for all of this, we will say, is $20,000. Let's go through who pays what. Since I have a $3,000 deductible, I need to write a check or use my health savings account or borrow $3,000 from my neighbors. Whatever I need to do, I am responsible for that first $3,000. For the remaining $17,000, insurance starts to kick in at 80%. So insurance will pay the remaining $13,600 and my 20% coinsurance responsibility is $3,400 that I still need to pay. But wait, remember, my plan has a $6,000 out-of-pocket maximum. So since I already paid my $3,000 deductible, once the coinsurance amounts that I pay add up to the other $3,000 left, bringing my total payments to $6,000, my out-of-pocket maximum has been met, and the insurance company now takes care of 100% of any covered charges. In this example, the total surgery cost was $20,000. I paid $6,000. Insurance paid $14,000. Any other covered healthcare services I have for the remainder of that year will be covered 100% by my insurance company because I hit that out-of-pocket maximum. This all resets back to zero for the next year. Where this may get a bit more confusing, as I mentioned earlier, is when an employer plan's deductible and out-of-pocket maximum are the same. This is actually the type of insurance I currently have with my plan. My deductible is $4,500 and my out-of-pocket maximum is $4,500. So I need to pay the first $4,500 of any care that I receive to hit my deductible, and then once I do, I've hit my out-of-pocket maximum as well. This isn't common, but some of you may experience something like this. All right, let's move on to Medicare now and see where common misunderstandings around these two terms happen with supplement plans, Advantage plans, and Part D drug plans. Original Medicare Part B has a deductible. In 2023, that number is $226. That is a very low deductible compared to our previous example that we just talked about. And then like our example, Part B then has a 20% coinsurance after you meet your deductible. Original Medicare does not have an out-of-pocket maximum, so you are responsible for 20% of all Part B expenses. Even if that turns into a $1 million claim, you would then be responsible for $200,000, which is why most people choose to cover this intimidating risk with either a supplement plan or an Advantage plan. With a supplement plan, specifically Plan G, you still have that Part B deductible of $226, but after that is met, your Plan G will cover 100% of all Medicare-approved services. That $226 deductible is sort of like your out-of-pocket max. Using this knee surgery as the example, you would pay the first $226. Original Medicare and your Plan G supplement plan take care of the remaining $19,774. If you have a high deductible Plan G, that deductible is $2,700 in 2023, and again, that is what you must pay first. After you do, the high deductible Plan G and Medicare will take care of the rest. All right, Advantage plans work much differently, and here's where a lot of comments with some confusion come in. Most Advantage plans do not have a deductible. Insurance coverage begins immediately, and the insurance company immediately starts paying for services, while you would have copays and co-insurance costs on top of those. All Advantage plans have an out-of-pocket maximum. The highest out-of-pocket maximum allowed for Advantage plans for in-network services in 2023 is $8,300. Of all of the plans that I've looked at in our state and the surrounding states, I'm in the Intermountain West, by the way, for those who are new to the channel, I have not seen a plan with an out-of-pocket maximum that high. The average around here is $5,500. There are plans with $1,000 out-of-pocket maximums in our surrounding states and plans with $7,000 out-of-pocket maximums. So they're all over the place. To compare as close as we can to our employer plan in the very first example, let's put the Advantage plan we're looking at with a $6,000 out-of-pocket max to be the same, despite being slightly higher than our average in our area. In our example, if I was on Medicare and I had this Advantage plan while having this surgery, I took the averages of a few plans here for the numbers that I'm going to talk about, but I would have a specialist copay of $25 per specialist visit. Let's assume that there are 2 visits pre-surgery, an imaging copay for that MRI, which is about $175, a copay for the surgery itself at $330, follow-up specialist visits, again at $25 per visit for 2 visits, and some physical therapy, let's say 10 sessions with a $25 per session copay for $250. So for this same surgery on an Advantage plan, I'm looking at about $855 all in as my out-of-pocket contribution. And here's where some people get hung up. How is it possible that the surgery and all of the visits under an Advantage plan only cost $855, while my employer plan, I hit my out-of-pocket maximum? One of the main reasons is because a deductible is not the same as an out-of-pocket max. Your employer plan with a $3,000 deductible means that you need to pay that first, and then you have a 20% coinsurance, which ends up costing you a lot more out-of-pocket. Again, most Advantage plans do not have a deductible, and for this specific surgery/provider visit workup, there are copays as part of the plan, not coinsurance. There are services out there where under an Advantage plan you may have coinsurance, like chemotherapy as an example, or you could have higher copays with things like inpatient hospital stays, but you would not have a deductible to meet first. Then, like the out-of-pocket maximum of any other plan, once the amount that you pay out of pocket meets your plan's out-of-pocket maximum, in this example at $6,000, your Advantage plan pays 100% of any other approved costs for that year. So does that help? There's one more area of confusion that is so important, and that is around Part D prescription drug coverage. Drug coverage is not included with supplement plans, period. You would need to purchase a standalone drug plan if you went that route. And then a drug plan often is included in an Advantage plan, but it is handled separately from that plan's copay and out-of-pocket max schedule that we just discussed. Part D plans typically have a deductible. Not all do, but from what we see, there are more plans that do have a deductible than those that do not. The highest deductible allowed in 2023 is $505. This means that if you have a plan with this deductible, you pay the first $505 of your medication costs before your insurance company starts paying, with some exceptions. Many plans will cover Tier 1 generic drugs, think low-cost medications, before the deductible. Some plans will cover Tiers 1 and 2 medications before the deductible. That varies by the plan. But for any drugs not covered this way, you need to pay the deductible first. There is an entire video right up here where we go over how Part D coverage works, but the last thing to mention is that currently Part D plans do not have an out-of-pocket maximum like we've described in this video. There is not a dollar amount where once you meet it, you no longer have any cost responsibility for your medications. This is set to change in 2024, where once you hit catastrophic coverage phase, you would have hit your out-of-pocket maximum. And then in 2025, there will be a $2,000 out-of-pocket max for the year. But in 2023, we just don't have that yet. Again, go check out our Part D deep dive for more information on that specifically. All right, if you didn't fully understand deductibles and out-of-pocket maximums, as well as the differences between them before this video, hopefully you're a little less confused after watching this video. If you have questions around this, feel free to throw them in the comments or reach out to us at 90daysfromretirement.com, and we're happy to look at your specific situation. All right, I won't ask you to subscribe to our channel in this video unless you really want to, but if you found this helpful, giving this video a like would go a long ways into helping our channel. I appreciate you, and we will see you in the next video.